Yeah, no problem at all. So I suppose about maybe 3.5 years ago, Richard Sullivan, who I work with very closely, who's at King's College London, and myself, probably partially prompted by the Lancet Oncology Commission that looked at cancer research in the US. We approached David Collinridge, who's the editor-in-chief of Lancet Oncology, and talked about doing a similar type effort for Europe, but with a different nuance to it, because we felt what's maybe relevant to the States isn't always relevant for Europe. And I suppose we approached him and sort of agreed it probably about 6 months before COVID came. And obviously, this report, as we originally intended, was meant to come out about a year and a half ago. But because of COVID, obviously it was delayed. But it was just as well, it was delayed because, to be perfectly frank, essentially, if we'd published it before COVID, probably the vast majority of what we were saying would not have been any longer relevant, because I think COVID has totally changed the picture in relation to that. And so I think, in a way, it was just as well we didn't publish it before. I didn't approach David earlier, because I think, it would have been something that would have gone out of date very quickly. Whereas I think now it's extremely pertinent. Obviously, some of the work we've done, particularly in relation to COVID and cancer, and that's very relevant, particularly for patients with hematological malignancies. 100 million screening tests were not performed, and also 1 million cancer diagnoses were missed. And we also saw impact on cancer health care workers. For example, 4 out of 10 were burned out. 3 out of 10 showed signs of clinical depression. And within that data, hematological malignancies, saw a significant impact in relation to both, particularly in relation to delays in diagnosis, but also impact in relation to treatment. And obviously, one of the challenges with hematological malignancies, patients with hematological malignancies, obviously they're immune suppressed as well. So the whole interplay between being immune suppressed, being vaccinated or not, and then the impact of sort of delays in diagnosis, delays in treatment, obviously had significant impacts in relation to that. And that, I suppose, then showed us that we really needed to look at developing things anew, and that's why we looked at really reimagining cancer research and its implementation in Europe, and that's been one of the catch lines, if you like, of the commission. Yeah, no, absolutely. So, I mean, a number of things. One, obviously, you're able to get scale within the comprehensive cancer centres that, sort of the centres will have seen enough cases of rare blood cancers that they're actually very able to deal with them from a clinical point of view, but also enter the patients into clinical trials, and also do look at ways in which the research effort is actually enhanced by the patients attending in comprehensive cancer centres. And we saw that, the much more uptake in terms of clinical trials, also then much higher quality research being done, both in terms of quantity, but also most importantly in terms of quality. And so again, I think it, particularly in the scenario where you're dealing with a rare disease, you need to be able to have a way in which you actually capture as many of those patients that can go into clinical trials as you can. And also the other important thing is obviously having those networks, so that there's networking between comprehensive cancer centers. Again, particularly important for rare tumors, both of adults and of children, in the hematological domain or hematological malignancy domain, because that confidence that that the there will be protocols in place, there will be research opportunities in place, and that really emphasize the opportunities for rare tumors.